This is something that can be really stressful for families, and it's often the number one thing that families have questions about during their newborn visit. We get a lot of questions about what kind of milk should I give my baby? Am I feeding my baby enough? Every family's feeding journey is really personal. So for us as pediatricians, it doesn't really matter what kind of milk you're giving. And so for some families, they're very interested in breastfeeding and nursing. And if that's the case, we are there to support that goal. And for other families, that's not feasible, or formula or bottle feeding is a better option. And all of us really abide by the same rule, which is fed is best. And our main goal during this period is to make sure that one's baby is gaining weight well in a healthy way, and that the whole feeding experience in general does not become overly stressful for the families. Every baby loses a little bit of weight after birth. Some babies lose more weight than others. Our goal is to make sure that weight loss is not too much, and that's why we're seeing families so frequently in the hospital and after birth, and really trying to work towards getting that weight back on track so that babies are back up at their birth weight by the 2-week mark. Every baby comes out with a different sized stomach and a different capacity to eat. For most babies, their stomach on average is sort of the size of a grape on day of life. And every day that your baby gets bigger, their stomach is gonna grow a little bit more and a little bit more. Your baby's also gonna get stronger every day and have a little bit more stamina when it comes to feeding. It doesn't take a lot to fill up your baby's stomach. It could just be in the beginning, a few milliliters of milk, and that's gonna go up over time. Your baby might not be able to feed or latch for very long on those first hours of life. And as they get older, we expect that stamina to improve and for your baby to just learn how to be better at feeding. In general, we recommend feeding your baby every 2 to 3 hours. That kind of averages out to 8 times a day. But in reality, your baby might be hungry every 45 minutes to an hour, and that's a normal part of the process. We call that cluster feeding, and all of that is just because your baby's eating these small, frequent meals to really fill up their stomach, and they are working their way through that milk really fast and find themselves hungry and ready to come back for more. As your baby gets a little bit older and develops a little bit more stamina, they're able to feed more volume at a time, and then they can last longer between feeds. A sign that your baby might be full is if they are unlatching from the breast or pulling their head away from the bottle, especially if it's been a reasonable amount of time, like 10 to 15 minutes. That's a good time to take a break and burp your baby. And then you can wait a few minutes and see if they show those hunger cues and if they're ready to go back for more. If your baby's sitting there and smacking its lips or sticking its hand in its mouth or sort of looking around the room, those are signs that they're hungry. The other thing you can do is just set a timer. So if it's been a couple of hours and your baby's starting to stir, then it's probably a good time to feed your newborn. The late hunger cues that might show that your baby's more hangry than hungry is crying, and those are stages that we don't really like to get to. Your baby might not be latching properly if their latch is really shallow and if their mouth isn't open wide enough. We also like to hear a suck and swallow sound for nursing families, and then also a really vigorous suck at the bottle for our babies who are bottle fed. For nursing moms, if you're feeling a lot of pain during those early days of latching, that might be an indication that your baby is not latching completely or latching properly. In the first couple of weeks, we are working really hard to make sure that we're feeding our babies around the clock. So we're having you wake up your baby every 2 to 3 hours regularly to feed them, even if they're passed out sleeping. That changes after the 2-week mark, where we loosen things up a little bit, and we want babies to start sleeping in longer stretches, and we want our parents to start sleeping as well. And part of that comes with just trying to learn and get more familiar with your baby's sleep and wake cues and their hunger and their feeding cues. Traditionally, we start introducing solid foods and other kinds of things into the diet at around 6 months of age. Depending on your baby's kind of own maturity, it might be a little bit earlier or it might be a little bit later. And for all of our breast and formula fed babies, we also start introducing sippy cups and different types of vessels other than the bottle at that time too, to give them some new skills. Most babies make that transition from breast milk and formula over to cow's milk at 1 year of age. We're also making a bunch of other transitions at that time. We are transitioning off of a bottle onto a cup. If your baby uses a pacifier, we're saying bye-bye to the pacifier. I know there's a lot of information out there and new information that's coming up every day, but the basics of feeding haven't really changed over time. And it's important to tune out all of the noise and just kind of focus on being a new parent, connecting with your baby, and getting through that day-to-day experience.